Hello, everyone. We are happy to launch our campaign through Youth Aware Worth a Shot. This is an effort from Youth Aware to raise awareness and education around the COVID vaccine and to answer any questions that the community has. We know that so many people are having questions and concerns and even some fears about this new technology. And we just want to use this as an initiative to answer questions that the community has. We were able to gather some questions that people have been wanting answers to. And today we are fortunate to have Dr. Amar Krishna, an infectious disease specialist and epidemiologist. Dr. Krishna currently practices at Northern Lights AR Gould Hospital in Maine, and we would love to get his perspective on the COVID vaccine. So thank you so much, Dr. Krishna, for joining us today.
Well, thank you for having me here.
Thank you so much. So, Dr. Krishna, 2020 has been a big year. 2020 has been the year of COVID-19. Can you please tell us about your experiences as an infectious disease specialist and physician up in Maine? How has it been for you? And what kind of case pattern have you seen there?
So it's been a very challenging year, 2020, uh, with the COVID, and we were initially we didn't have many cases up here in Maine. Um, we did see cases in New York and then Florida, but lately we have been seeing cases up here as well. And we've had many things going on in the hospital. We started uh, screening people coming to the hospital, and we started, using masks. Like employ all the employees have been wearing masks, and this has been going on probably since I think April, May. But yeah, lately we have been seeing cases. We have had patients admitted to the hospital, and we are seeing quite a bit of cases in the community as well.
So now that the COVID-19 vaccine is out, people have lots of questions and concerns about it, especially since this is a new technology, the mRNA technology. So please tell us a little bit about what mRNA vaccines are and about how they work.
So this is a new technology, mRNA vaccines. It has been studied, I think, previously, but this how this works. The mRNA vaccine is they are you know we are it uses a piece of genetic material, and this genetic material is injected to a person, and the material, it will go into the cells, and once it goes into the cells, it will make the cell to make a protein, which is the protein which is seen on the virus. And once it makes the protein, the genetic material that was injected, the cell degrades the material. So the material itself, it won't alter your genetic material, or it won't go into the cell's nucleus. And once this genetic material is degraded and a protein is made, this protein is in turn presented to your body, and the body starts making an immune response to it. And that's how you develop immunity. Unlike previous vaccines, where we used to inject the antigen which was present on the virus, here we instead inject uh, a genetic material, and we ask uh, our own body to make the protein or make the antigen, to which our body in turn uh, makes a makes an immune response.
Yes, thank you. I know that mRNA vaccines are a very new technology and a very interesting technology as well, in that they're very different from previous vaccine types. So many people in the community are have concerns about the speed at which these vaccines were developed. I know that normally it would take many years for the whole process of developing a vaccine to be completed. So, how were these mRNA vaccines made and developed so quickly? And are they safe for people to take even though they were made and developed so quickly?
So I think when this pandemic started, the US government uh, they started this one called Operation Warp Speed, and that was programmed to produce a very vaccine as soon as possible. And so and that's why they use this technology, because this is the technology, the mRNA vaccine. It's the probably the quickest way to produce a vaccine. And to produce a vaccine through this technology, all you need is just a piece of the genetic material. You don't need to grow the virus. You just need a piece of the genetic material, and that will help. That's all it is needed. So that is the reason we have had this vaccine produced so quickly. But at the same time, this vaccine underwent trials, clinical trials, and it was tested on tens and thousands of people were tested, and uh, it was made sure that it was safe. And so even though it was produced so quickly, it went through all the same processes that a vaccine goes through before it gets an approval.
Thank you so much. And I think that's a very important point to touch on, especially since I know many people have questions about this and are concerned about the safety of the vaccine, especially since it was made so quickly. But it's important to know that it went through the whole process and it was tested, it went through all the phases of testing. And that's just a very important point for people to be aware of. So I know that we talked about this a little bit earlier, but do mRNA vaccines affect our genetic makeup at all? Do they affect our genes or our DNA?
No, it doesn't, because as I was saying earlier, it doesn't enter the cell's nucleus, or it doesn't mix with a person's genetic material, and it is, your body degrades it as soon as the protein is made. Your body degrades the vaccine. It degrades the mRNA, so uh, it doesn't affect a person's genetic makeup. No.
So I know that there are these two main companies that have produced the vaccines, Pfizer and Moderna. And I know both of them got approval. So please tell us a little bit about the Pfizer and the Moderna vaccines. Is one more effective than the other? And what are the timelines of these vaccines? And do you think this will be something like the flu vaccine where we have to take it every year?
So both are mRNA vaccine, the Pfizer and the Moderna ones. And on clinical trials, they've shown pretty much the same effectiveness. I think it's around 94-95%. So both were pretty much as effective as the other. And regarding uh, regarding the dosage, both are given in 2 doses. With the Pfizer vaccine, the doses are spaced 21 days apart, whereas with your Moderna vaccine, it is about a month apart or 28 days apart. between the doses.
Yes, and I know that these are very similar technologies with the mRNA, and this is also very new technology. So it's really remarkable how they were developed so quickly, and they have such a high efficacy as well.
It is, yeah.
So I know that people have gone through these clinical trials and they've reported some side effects. And Dr. Krishna, can you please tell us what some of the side effects that we can expect from the vaccines? What are some of those side effects that we can expect when we receive the vaccine?
So most commonly with the vaccine, you see at the site of the injection, you might develop pain or you might develop swelling. So those are the most common effects that you have at the site of the injection. People can also develop they can develop fevers, they can develop a headache, or they can feel weak and sometimes muscle pain. So these are some of the most common side effects, and most of these side effects have only lasted for short periods, anywhere between 1 to 2 days. Usually, they tend to go away on its own, and sometimes people, if they have pain, they can use use a over the counter pain medication to help with the pain. So you do get side effects, and but usually they're not they don't last very long.
Yes, that's a very important point to note that these side effects haven't been very serious and they haven't been lasting very long. And it's a lot better to take the vaccine and to know that you're protected from the virus. So that's one message that we really want to highlight.
Sure.
So, are there any recommendations for women who are pregnant or who are nursing?
So currently the CDC, which is the Center for Disease Control, so they uh, of course, there are not much data out there about this vaccine use in pregnant women or in lactating mothers, but uh, it's not a contraindication if you're pregnant to not receive the vaccine. And people who are currently getting the vaccine, mostly who are working in healthcare, they can even if they're pregnant, they can get the vaccine. It's not contraindicated, but again, uh, right now we don't have much data how how it can affect pregnant patients or women who are breastfeeding. But per the CDC, the risk they don't anticipate much of a risk in these group of patients. And at the other end, you also have to consider the risk of having an infection with the coronavirus, and so that risk is also there. So you have to weigh the risk and benefits of getting a vaccine. So if you are in a place where there is a lot of people who have the disease, then it's probably getting the vaccine uh, might be the better option, might be beneficial, because it will prevent you from getting the infection, especially if you are pregnant and you don't want to get the infection. But again, the data, we don't have much data on these different groups.
Thank you so much. And another common question that came up a lot is about people with underlying health conditions. And many people have been wondering in the community, should I receive the vaccine or should I not if I have a health condition. So are there any groups of people who shouldn't receive this vaccine?
So currently, the only groups of people who are not recommended to get the vaccine is those who have had allergic reaction to the vaccine. So other than that, most groups can get it, although as I was saying, we don't have safety data on all these different groups, like people who have weak immune systems. We don't know whether they will be able to develop a good immune response to the vaccine. So we don't have that data, but again, the CDC is saying these group of people can get it as well. However, if you had suppose someone got a dose of the vaccine and they had a serious allergic reaction to it, what's called anaphylaxis, then uh, those uh, uh, those people are not supposed to uh, get the second dose uh, because uh, because of the allergic reaction. But other than that, it is not restricted for any other groups. Even people who have previously had the coronavirus, even they can be vaccinated.
And the next question also relates to the previous one. This was something that we were discussing a little bit. And we often hear about vaccines and with vaccine trials that some people have had anaphylaxis. What is it, and what are the chances that someone might develop it with the COVID vaccine?
So anaphylaxis, it's a um, term used to describe a severe allergic reaction to something, whether it could be the vaccine or it could be something a person is allergic to, like some foods. And so people, when they develop this type of reaction, they can become quickly they can quickly deteriorate, and they can have trouble breathing, and their blood pressure can drop, and they can start feeling dizzy, and they can develop swelling in their throat, and they can develop restriction to their breathing. So this is a type of severe reaction, and sometimes people can also develop a rash. And so um, regarding how frequently this develops in people who are getting the Pfizer or the Moderna vaccines, we don't know that yet. Certainly, there has been some reports, but currently they are collecting that data, and we don't know how frequently this happens. But it's not been very frequent. But it's again, like I said, we are just waiting for the data to see um, how frequently this is happening.
Yes, and our goal at Youth Aware through Worth a Shot is really to just give people the information and allow people to be aware of the vaccine and the different data that's coming in. And I think that as more data comes in, we'll have more information.
Yeah.
So many people have said that they're hesitant about receiving the vaccine, and that could be for many reasons. So, Dr. Krishna, what would you say to those people who are hesitant?
So I think um, definitely they have to talk with their providers, and again, it depends on what the specific reason is that they're hesitant to receive the vaccine, whether it's because they don't feel that the vaccine is effective, or whether they are worried about developing side effects from it, or whether they have a condition and they feel that might interfere with the vaccination in some way. So I think these are some of the questions, and again, um, we can, if we address these questions, and I think that will uh, uh, resolve some of the doubts that people might have, and they they might be then more willing to get the vaccine. And also we have to think about two things here. One is the vaccine. Of course, this is a new vaccine. We don't know everything about the vaccine, because people are just starting to get the vaccine. But at the other side, we have to look about the COVID-19 disease, and we certainly know that, of course, not all people get very sick, but certainly many people, quite a few people have got really sick from the disease, and they have even many people have lost their lives because of it. So it's and we clearly know that the um, vaccine prevents someone from getting this disease, and so that is something we have to consider, and people have to make that decision. And um, especially if you are in a place where you are more likely to get the disease, I think getting the vaccine will be very important. Although, it would be very helpful if we get more data to see how safe it is. But again, at this time, while we are waiting on the data, we also have to encourage people to get the vaccine, because especially some people, some people who have some underlying conditions, they might be at very high risk of getting a severe COVID-19 infection. Um, and as we have seen from the trials, that vaccine uh, might be able to prevent that. And so I would try to address um, each person's concern regarding the vaccine. And again, at the same time, you have to educate them uh, about the risk of having the COVID-19, and what that uh, what that might, for that particular person, uh, how much risk they are at to get, if that they might get a severe disease. So I think these things and education about the safety of the vaccines will help.
Yes, and we know that ultimately it's up to people whether they want to get the vaccine or not. But it's more than anything, it's important for people to make that decision informed and make that decision weighing the risks of getting the vaccine versus getting the infection. So it's very important for people to have answers to these common questions, because I think that's a huge part of it, just having answers to the questions that they have, and just encouraging people to get the vaccine through answering their questions and addressing their concerns. So, Dr. Krishna, we often hear the term herd immunity when it comes to not only COVID-19, but to other outbreaks. So, how important do you think this vaccine is to achieve herd immunity? And how many people do you think will have to receive the vaccine to achieve herd immunity?
So the vaccine might, it will definitely make more people resistant to the virus. It will build immunity in a lot more people with vaccination. But at um, what point will get herd immunity? I think that question uh, there is still research going about it. So we don't know whether it's 70%, 80%, or 85%. So we don't know that at this point. Uh, but uh, but the more people are vaccinated, the uh, more chances of having that.
Yes, it's very important to know that each person vaccinated makes a difference, and just one more person getting the vaccine makes a huge impact. And that's something that's very important for people to know, that just going and getting themselves vaccinated could help save many lives. And while we don't know how many people need to receive it to achieve herd immunity, just getting one more person vaccinated is a huge step towards achieving that goal.
Yeah, definitely.
I know that the vaccine hasn't been approved for kids yet. When do you think that kids will be able to receive this vaccine? And when do you think that things will go back to normal?
Well, I think currently studies are going on in children, to see if it's safe. Currently, I think the Pfizer vaccine is approved for anyone 16 and above, 16 and above years old, whereas the Moderna is 18 and above. So definitely research is going on in younger children, and so once we have that data available, then so probably I would think sometime next year, but we'll have to see. And yeah, regarding when we can go back, that question, that's a $1 million question, but we'll have to see. It all depends on many things, about people we getting herd immunity, and depending upon how long the vaccine will be effective for. And so it depends on a lot of things, and so we don't know that yet.
Thank you so much, Dr. Krishna. This was very great advice. And we want to emphasize that we need as many people vaccinated as we can get, and every person that gets vaccinated is another step in the direction of normal. So while we don't know when we're going to be able to go back to a normal life after this pandemic, it's so important that we have the solution right here, and it's a matter of getting this vaccine to as many people as possible. So thank you so much, Dr. Krishna, for joining us today.
Yes, thank you. Thanks so much. Thanks for having me.